We are speaking with Dr. Domingo Alviar, the chairman of the World Surgical Foundation, who has had tremendous service to many countries around the world and definitely is an expert in various fields of medicine. Now, Dr. Alviar, as we can see and notice now from the interviews we have been doing and monitoring all these information campaign, that even the United States lack ventilators and respirators and gloves and masks, meaning to say no country in the world is ready for a pandemic.
I don't think so. If you remember, in New York, they're going to bring in a hospital ship in the harbor of New York City. And the hospital ship has 1,000 beds. And that hospital ship has maybe a few, maybe some ventilators, but not 1,000 ventilators. Because not everybody will require a ventilator if you get sick from this virus, unless you have an underlying disease. Unfortunately, in the Philippines, I have reports from my classmates and from the people who are the World Surgical Foundation Philippines that some doctors have died recently because they needed required a ventilator, and even if they're in a good hospital in Manila or Makati, they still died because of the severity of the disease.
Mm-hmm. You mentioned the lack of protective equipment like masks and gloves. How important are these for the healthcare professionals dealing with those with the coronavirus?
Well, those who are taking care of the sick people, they need to have a mask. Those who are sick from it, and they need to have a mask because they are, obviously going to spread the disease. The people who are not sick, they don't have to have a mask if they just stay away from too many people and spread the disease, even if they are healthy because their immune system is good. They don't have to have a mask. They don't need to have a mask. But the healthcare worker, they need to have a mask and gloves to protect themselves so they can continue to help with the people who are sick.
Mm-hmm. And for those who are symptomatic, and they have to go to work, they're suffering from colds and flu, of course, they would have to stay home. But even when they go out, what type of mask do you advise if there is no available mask?
Well, we have that special mask that people are using. That's why in the States they have the industrial mask. Those are safe masks because the people who have the industrial mask and they work in chemicals and a lot of dust. And so that president asked the people who are doing this industrial mask to offer it to the hospitals, to the healthcare workers. That's a very strong mask. But a regular mask will do, just a simple. It can still protect you somewhat, but it's not going to be 100%. There's still, you need to wash your hands, and you have to keep a distance from people, and so this so-called social distancing, and that's most important.
Do you agree, Dr. Alviar, that not all people should undergo testing for coronavirus unless, of course, they show symptoms?
That's correct, because if everybody wants to have a testing, then we're going to overrun the system, and we're going to waste a lot of those tests that is important for those that require the test. So there's not enough of that at the moment. So it's best that if you're healthy and you don't feel any symptoms, don't get tested. They won't let you. They won't test you anyway. Right now in the States.
And do you favor sheltering that's now going on in California and will be doing in New York and other communities as well?
Well, it's basically saying stay at home. That's what they call shelter in place, meaning you stay at home. But what are you going to do with the homeless? That's a big problem they have there.
That's true.
Yeah.
What things have you heard so far, Dr. Alviar, that you feel that should have been mentioned and had not been mentioned in the past?
Well, what's happening in the Philippines is that most people, the jobs they have is just a simple job, which is to sell things and to service people. So those people don't have any means to get the money. If they're not preserved, but most often they don't. So they have to supply them with some food. So our group, the World Surgical Foundation Philippines, our current president, Dr. Lester Santay, asked me if they could get donation from people to give the people a care package that will last, that could help them for maybe a week or less.